Surgical site infections, or SSIs, remain a prevalent threat to patient safety, with an estimated 157,500 SSIs occurring in 2011. 3% of patients with an SSI will expire, and 75% of those patient deaths are a direct result of the SSI. Proper surgical hand scrub or rub techniques are essential to decreasing the incidence of SSIs. Operating room personnel may use anatomical surgical hand scrub. There are 2 hospital-approved antiseptics for surgical hand scrub: chlorhexidine and betadine. Both antiseptics for anatomical surgical hand scrub may be used for any case, including the first case of the day. Pre-scrub. Before beginning the procedure, remove all jewelry from both hands and arms. Nails must not extend past the fingertips, and nail polish must be intact without chips or scratches. No artificial nails, acrylics, or nails with foreign bodies are allowed in the operating room. It is also important to make sure your skin is free of all cuts and wounds. Tuck hair and ears into your surgical head covering and make sure any neck jewelry is contained in your surgical attire scrubs. Don proper eye protection and a surgical mask covering your nose, mouth, and facial hair if applicable. Anatomical surgical hand scrub with counted brushstroke method. To begin the scrub, tear open a sponge of your preferred antiseptic, either chlorhexidine or betadine. Place the open packet on the shelf above the sink with the tear facing the ceiling. If scrubbing for the first case of the day, or if hands and nails are visibly soiled, wash hands and arms thoroughly with hospital-approved soap and water to remove any gross contamination or transient flora. Then use the disposable nail pick and clean the subungual areas of the fingernails under running water. Dispose of the nail pick in the trash can beside the scrub sink and rinse hands and forearms. Hands and arms must be washed and nails must be picked before the first case of the day or if hands are visibly soiled. Subsequent uses do not require the pre-wash unless hands and nails are visibly soiled. Once hands and arms have been washed, remove the sterile surgical sponge from its wrapper and moisten the sponge under running water by squeezing and releasing it. With the fingertips together, use a light but firm pressure to stroke the nails in a back and forth motion with the abrasive brush side of the sponge approximately 30 times. The abrasive brush side of the sponge is to be used only for this step. The non-abrasive side should be used for the remainder of the scrub. Next, turn the surgical sponge over to the non-abrasive side of the sponge. Place fingers side by side, including the thumb, and scrub the surface of the palm 10 strokes. Then turn the hand over and scrub the dorsal surface 10 strokes. Starting with the thumb, scrub the outside surface of the thumb from the wrist to the tip of the thumb 10 strokes. Continue to scrub each consecutive finger, applying 10 strokes on both sides of each finger. When scrubbing the outside surface of the pinky and thumb, scrub from the wrist to the fingertip 10 strokes. Do not return to the hand once it's completed. After the hand has been completed, mentally divide the forearm into thirds from the wrist up to 2 inches above the elbow. When scrubbing each section, apply 10 strokes to the top, bottom, and both sides of each section. Do not return to the section once it's completed. Repeat the scrub on the other hand and arm, but do not return to the area that was previously cleaned. If done correctly, a surgical hand scrub using the counted brushstroke method should take approximately 3 to 5 minutes. Once both hands and arms are complete, discard the surgical sponge in the trash can beside the scrub sink. Rinse hands and arms under running water, always keeping elbows at a right angle and hands raised above the elbow level. Begin the rinse with the fingertips and continue to the hands, forearms, and elbows, moving in one forward direction through the water. Do not move arms back and forth in the water. If additional rinsing is necessary, completely remove the arm from the water stream and re-enter at the fingertips until you reach the elbow. If at any point you accidentally touch the surface of the sink or any other non-sterile surface, you must return to the contaminated area and re-scrub 10 strokes. Once rinsing is complete and no antiseptic remains on the hands and arms, turn off the water with the knee control. To avoid contamination, keep hands above elbow level and away from scrub attire and non-sterile surfaces to avoid contamination. Allow residual water to drip off the elbows and into the sink. Do not shake or wave hands and arms to remove excess water. With hands still above elbow level, walk backwards into the operating room and dry hands and arms with a sterile towel before donning a sterile surgical gown and gloves. Proper anatomical surgical hand scrub is an important tool to help prevent SSIs. Thank you for watching this video and working to keep patients safe from infections.